Hello, my dear friends. It is a real pleasure to be here with you today. If you are over 50, 60, or perhaps enjoying those wonderful decades that follow, and you have noticed that your intimate moments feel a bit different lately, then this video is for you. I am Dr. Evelyn Ross, a specialist in male health. Today, we are going to discuss something that many men experience, but almost no one has the courage to talk about at the coffee shop or even in the doctor's office. I am talking about that feeling of full pleasure, that moment of climax, but without the presence of any fluid. Maybe this happened to you just once, and you immediately felt a knot of worry in your stomach. Or perhaps it has become a silent, recurring issue that you have been keeping to yourself, feeling a bit of shame or a deep fear about what this means for your health and your masculinity. You know what I hear all the time in my office? A patient comes in, sits down in that chair right in front of me, looks around to make sure no one is listening and says, "Doctor, I feel everything. The pleasure is there, but nothing comes out. Am I broken? Is my masculinity gone? Is my love life over? I want you to take a deep breath right now." What you are noticing in your body is not a sign that you have stopped being a man or that your time has passed. Not at all. Think of it from a different angle. This is not a failure of your body. It is a detailed message your body is sending you, and that message simply needs to be decoded. Stay with me for the next few minutes because we are going to dive deep into this. We will understand the mechanics, the causes that surprise many people, the warning signs that cannot be ignored, and most importantly, the practical solutions that modern medicine offers to give you back your peace of mind and your confidence. Before we talk about why the fluid disappears, let me explain how things are supposed to work in a normal scenario. Imagine the male reproductive system as a perfectly synchronized orchestra. On one side, we have the testicles producing sperm. On the other, we have the seminal vesicles, which contribute most of the fluid, and we also have the prostate adding a protective layer to the mix. This final cocktail is gathered and prepared in the urethra. When the climax arrives, specific muscles contract in a powerful rhythmic sequence to propel that mixture forward and out. It is a fast event, the result of a delicate harmony between nerves, glands, and muscles. Now here is where many people get confused. You might be asking, "Doctor, if I feel the pleasure, why does the liquid not come out? Is it not the same thing?" No, it is not. And understanding this will change your perspective. The climax and the ejaculation are separate processes. Climax is a neurological sensation of intense pleasure, governed by your brain and your nervous system. Ejaculation is the physical, mechanical act of expelling fluid. For most of your life, they happen together and feel like one thing, but they are driven by different gears. What we are discussing today is called dry ejaculation. That is the technical term for when a man reaches the peak and feels that characteristic pleasure, but notices little to no fluid is released. Many patients describe it to me as an empty orgasm. I perfectly understand why that causes distress. You have spent your whole life associating pleasure with that physical signal. But look at it this way. Your ability to feel pleasure remains intact because your nerves and your brain are working just fine. The change is in the plumbing, in the delivery of the product. It does not mean you have lost your virility. It just means the pipes in your body have a specific reason for behaving this way. Now let us explore why this happens. We will look at the three most common causes, and I bet you will identify with one of them. The first cause, and by far the most common, is what we call retrograde ejaculation. To understand this, imagine there is a doorman, a small muscular valve, right at the exit of your bladder. In a normal situation, when the climax happens, this doorman shuts the door to the bladder tight. This ensures the fluid only has one way to go, forward and out. But over time, or due to other factors, that doorman can get too relaxed. He basically falls asleep on the job. And what happens? The fluid, which always looks for the path of least resistance, ends up going backward into the bladder instead of out through the penis. You feel all the pleasure of the climax, but since the fluid took the wrong turn, the ejaculation seems dry. You might be thinking, doctor, where does that liquid go then? Does it get stuck? No, it simply mixes with your urine. A classic sign of retrograde ejaculation is noticing that your urine looks a bit cloudy or milky right after intimacy. It is just the fluid being expelled later when you go to the bathroom. And why does this doorman relax? Often, it is a result of prostate or bladder surgeries. These are necessary procedures for your health, but they can affect the delicate nerves that control that valve. Another very common cause is medication for high blood pressure or an enlarged prostate. The medicine doing its job relaxes the muscles to improve urine flow, but it ends up relaxing the bladder doorman too. I remember a patient, a very active and proud gentleman, who came to me in a panic after prostate surgery. He thought he would never be the same. When I explained it was just a mechanical change, like a traffic light stuck on green in the wrong direction, and that his desire and pleasure would not be affected, the relief on his face was instant. It is a matter of plumbing, not potency. The second major cause is when the pipes are blocked. We call this ductal obstruction. Imagine the glands are producing fluid normally, the factory is running at full speed, but the delivery pipes are blocked. If the pipe is clogged, the delivery truck cannot get through. The volume of liquid drops drastically or disappears, even though production is perfect in the back. What causes this blockage? It could be a scar left by an old infection, like a case of prostatitis that was not fully treated in the past. Sometimes small calcifications, like tiny stones, can form and block the path. The symptoms can be subtle. Some men report a slight discomfort in the pelvic area during climax, or they notice that over months or years, the fluid became thicker and less frequent. The good news is that many of these obstructions can be resolved with medications that fight inflammation, or in some cases, simple procedures that restore normal flow. It is like calling a specialist to clear out the pipes. Now we come to the third cause, which is fundamental and affects many men as the years go by. The fuel is low. I am talking about hormonal factors, specifically low testosterone. Think of testosterone as the premium fuel for the male reproductive system. It does not just regulate sexual desire, it is essential for the prostate and seminal vesicles to function at their best. These glands are what manufacture the bulk of the ejaculate volume. When testosterone levels drop significantly, which happens naturally with age but is more severe in some men, the whole system starts running in slow motion. The amount of fluid decreases, but you might also notice a drop in libido, less firm erections, constant fatigue, mood swings, and loss of muscle mass. Many men make the mistake of thinking this is just the weight of old age. But let me ask you, if your car is stalling because the fuel is bad, do you just accept that it will not run anymore, or do you go to the station and refill? Low hormones are a treatable condition. A simple blood test can confirm this, and hormone replacement therapy, when guided by a doctor, can restore your fluid production, your energy, and your zest for life. It is like giving your engine a full tune-up. While most of the time the causes are manageable, as your doctor, I must mention a few important exceptions. Sometimes dry ejaculation can be a warning sign for something that needs immediate attention. You should see an expert urgently if dry ejaculation appears suddenly, especially if it comes with pain, blood in the urine or fluid, fever, or any loss of sensation in the genital area. These are signs that something more serious might be happening, such as neurological issues, uncontrolled diabetes, or in rare cases, specific tumors. The body warns us, and ignoring those warnings is like ignoring the oil light flashing on your car's dashboard. Beyond the physical, there is a wound that does not show up on blood tests, the emotional impact. I know many men measure their masculinity and their performance by the volume of fluid. When it disappears, feelings of inadequacy, anxiety, and frustration grow like weeds. It is common for men to start avoiding intimacy out of fear of being judged. I want to give you a virtual hug right now and tell you to stop that. Understanding that this is a physiological change and not a character flaw or a loss of virility takes a huge weight off your shoulders. Your ability to feel pleasure, to have erections, and to connect with the person you love does not depend on a few milliliters of fluid. Your intimate life can and should remain a source of joy. So, what is our plan of action? We are not going to sit around waiting for the problem to vanish on its own. First, do not ignore it. Investigate it. If you notice this change, book an appointment. A good medical history and some simple lab tests are usually enough for a clear diagnosis. Knowledge brings peace. Second, take care of your underlying health. If you have diabetes, high blood pressure, or high cholesterol, keep them under tight control. These conditions directly affect the health of the vessels and nerves that manage everything we talked about today. This is preventive maintenance for your body. Third, break the silence. Talk openly with your partner. Explain what is happening and what you learned today. Dialogue takes the power away from shame. And of course, talk to your doctor. Sometimes simply adjusting a medication is all you need to solve the problem. To wrap up our conversation, the absence of fluid is not the end of your intimate life. It is not a verdict that you have grown old and lost your value. It is a signal from your body that deserves to be heard. Whether the cause is mechanical, a blockage, or hormonal, there is always a path to a solution. I have seen countless men recover their confidence and vitality after understanding what was happening and following a plan. Your vitality is not measured by fluid volume. It is measured by your health, your well-being, and your ability to live fully. Do not let doubt or shame stop you from seeking answers. Acting in time can completely transform your experience and give you back the security you deserve. I hope this conversation has shed some light on your questions. If you found this information helpful, please share it with a friend or a brother who might be going through this in silence. Sometimes a message like this is the push a man needs to start taking care of himself again. Always remember, your best years can still be ahead of you. Be proactive with your health, stay confident, and take good care of yourself. I am Dr. Evelyn Ross, and I look forward to seeing you soon as we continue to look after your vitality. Until next time.